Hello everyone. Welcome back to our channel. Today, we're covering a crucial topic in surgical care, antibiotic prophylaxis. This is essential for reducing the risk of perioperative infections, which can significantly impact patient outcomes. Before we dive into the details, let's go over some USMLE-style questions to test your understanding and prepare you for what's to come. 1. What is the primary goal of antibiotic prophylaxis in surgery? A. Treat existing infections. B. Reduce the risk of perioperative sepsis. C. Enhance recovery speed. D. Prevent postoperative pain. Answer: B. Reduce the risk of perioperative sepsis. Explanation: antibiotic prophylaxis aims to reduce the risk of infections that can occur during or after surgery, particularly to prevent sepsis. 2. When should prophylactic antibiotics ideally be administered? A. After surgery is completed. B. Around the time of induction of anesthesia. C. Before the patient is discharged. D. Immediately after the operation. Answer: B. Around the time of induction of anesthesia. Explanation: for prophylactic antibiotics to be effective, they should be given before contamination occurs, ideally at the time of induction of anesthesia. 3. Which bacteria are commonly targeted by antibiotic prophylaxis in surgery? A. Mycobacterium tuberculosis. B. Staphylococcus aureus. C. Pseudomonas aeruginosa. D. Legionella pneumophila. Answer: B. Staphylococcus aureus. Explanation: common targets for prophylaxis include Staphylococcus aureus, Streptococcus species, and Enterobacteriaceae, among others. 4. What antibiotic regimen is recommended for appendicectomy or uncomplicated appendicitis? A. Ciprofloxacin and metronidazole. B. Ampicillin and metronidazole. C. Gentamicin and cefuroxime. D. Amoxicillin and clavulanic acid. Answer: B. Ampicillin and metronidazole. Explanation: for appendicectomy, a common regimen includes ampicillin and metronidazole. Doses vary by patient age and weight. 5. Which antibiotic should be used for dental procedures in patients with heart valve prostheses who are allergic to penicillin? A. Clindamycin. B. Ampicillin. C. Gentamicin. D. Metronidazole. Answer: A. Clindamycin. Explanation: for patients with penicillin allergies undergoing dental procedures, clindamycin is often used as an alternative. Now, let's discuss antibiotic prophylaxis in more detail. Antibiotic prophylaxis refers to the use of antibiotics to prevent infections, especially in the perioperative period. The goal is to reduce the incidence of postoperative infections, which can lead to significant complications and affect recovery. To be effective, prophylactic antibiotics should be administered before contamination occurs, ideally around the time of anesthesia induction. Causes of infection targeted by prophylaxis. Staphylococcus aureus, a common cause of surgical site infections. Streptococcus species, often involved in infections related to skin and soft tissues. Enterobacteriaceae, important for infections from gastrointestinal sources. Anaerobes, particularly relevant in gastrointestinal procedures. Coagulase-negative staphylococci, important in surgeries involving implants or cardiac procedures. Objectives of antibiotic prophylaxis: prevent infections. Prevent complications related to infections. Indications for prophylaxis. Proven indications: these include surgeries like appendicitis, colon and rectal surgeries, biliary tract surgeries, and hysterectomies. Prophylaxis is also recommended for surgeries involving pus, patients with rheumatic or congenital heart disease. Accepted indications include surgeries involving implants, cardiovascular surgeries, and cesarean sections. Possible indications: thoracic surgery, neurosurgery, genitourinary tract surgeries, and trauma surgeries may also require prophylaxis based on specific risks. Choosing the right antibiotic. When selecting antibiotics for prophylaxis, considerations include activity against anticipated pathogens, minimizing the development of antimicrobial resistance, achieving high concentrations at the infection site, ensuring safe metabolism and excretion, minimizing adverse reactions, considering cost-effectiveness. Antibiotic regimens for specific surgeries. 1. Appendicectomy/uncomplicated appendicitis. Ampicillin, 4. Adults, 1 g. Children, 6 to 12 years, 500 mg, 5 years, 250 mg. Metronidazole, 4. Adults, 500 mg single dose at induction. Children, 7.5 mg/kg single dose at induction. Alternatively, metronidazole, rectally. Adults, 1 g 1 hour before surgery. Children, 125 to 250 mg 1 hour before surgery. 2. Resection of the colon or rectum or obstructed bowel. Gentamicin, 4, 5 mg/kg. Metronidazole, 4. Adults, 500 mg. Children, 7.5 mg/kg. Cefuroxime, 4. Adults, 1.5 g. Children, 60 mg/kg as a single dose. Alternatively, ciprofloxacin, 4. Adults, 400 mg every 8 to 12 hours. Children, 10 mg/kg every 12 hours, maximum 400 mg. 3. Biliary tract surgery. Gentamicin, 4, single dose as above. Cefuroxime, 4, single dose as above. 4. Hysterectomy. Metronidazole, 4, 500 mg single dose. 5. Dental procedures for patients with heart valve prostheses. Under local anesthesia. Amoxicillin. Adults, 3 g 1 hour before the procedure. Children, 6 to 12 years, 1.5 g, 5 years, 750 mg. If allergic to penicillin or recent multiple doses. Clindamycin. Adults, 600 mg. Children, 5 to 10 years, 300 mg, 5 years, 150 mg. For patients with previous endocarditis. Adults. Ampicillin, 4, 1 g. Gentamicin, 4, 120 mg at induction. Amoxicillin, oral, 500 mg 6 hours later. Children. Ampicillin, 4, 6 to 12 years, 500 mg, 5 years, 250 mg. Gentamicin, 4, 2 mg/kg. Amoxicillin, oral, 6 to 12 years, 250 mg, 5 years, 125 mg. Under general anesthesia. Amoxicillin and clavulanic acid, 4. Adults, 1.2 g at induction. Then amoxicillin, oral, 500 mg 6 hours later. Children, 5 to 10 years, 1/2 of adult dose, 5 years, 1/4 of adult dose. For penicillin allergy or multiple doses of penicillin. Clindamycin, 4. Adults, 300 mg over at least 10 minutes at induction or 15 minutes before the procedure, then 150 mg 6 hours later. Children, 6 mg/kg stat, 3 mg/kg 6 hours later. Antibiotic prophylaxis refers to the administration of antibiotics to reduce the risk of perioperative sepsis, a significant cause of morbidity and mortality in surgery. For prophylaxis to be effective, antibiotics must be administered before contamination occurs, ideally around the time of induction of anesthesia, ensuring tissues are saturated with the antibiotic. Causes of infection that antibiotic prophylaxis targets include Staphylococcus aureus, Streptococcus species, Enterobacteriaceae, GI, anaerobes, GI, coagulase-negative staphylococci, especially in cardiac and implantation surgeries. Objectives of antibiotic prophylaxis: prevent infections, prevent complications. Indications for prophylaxis. Proven indications: acute appendicitis and intestinal obstruction, surgery on the colon and rectum, surgery on the biliary tract, gastroesophageal and oropharyngeal surgery for carcinoma, hysterectomy, surgery in the presence of pus, patients with rheumatic heart disease, patients with congenital heart disease. Accepted indications: implant surgery where prosthesis and device implants are used, cardiovascular surgery, cesarean section. Possible indications: thoracic surgery, neurosurgery, surgery on the genitourinary tract, trauma surgery. Choice of antibiotics for prophylaxis should consider antibacterial activity against anticipated pathogens, minimization of antimicrobial resistance, high concentration at the infection site, safe metabolism and excretion, few toxic or adverse reactions, affordability, antibiotic regimens for specific surgical procedures, appendicectomy/uncomplicated appendicitis, ampicillin, for adults, 1g, children, 6 to 12 years, 500 mg, 5 years, 250 mg. Metronidazole, for adults, 500 mg single dose at induction. Children, 7.5 mg/kg single dose at induction. Or metronidazole, rectally. Adults, 1g 1 hour before surgery. Children, 125 to 250 mg 1 hour before surgery. Resection of the colon or rectum or obstructed bowel. Gentamicin, for 5 mg/kg. Metronidazole, for adults, 500 mg. Children, 7.5 mg/kg. Or metronidazole, for doses same as above. And cefuroxime, for adults, 1.5 g. Children, 60 mg/kg as a single dose. Or ciprofloxacin, for to be administered over 60 minutes. Adults, 400 mg every 8 to 12 hours. Children, 10 mg/kg every 12 hours, maximum 400 mg. And metronidazole, for adults, 500 mg stat. Children, 7.5 mg/kg stat. Biliary tract surgery. Single dose of gentamicin, for same as above. And cefuroxime, for same as above. Hysterectomy. Single dose of metronidazole, for 500 mg. Dental procedures for patients with heart valve prostheses, rheumatic heart disease, septal defect, and patent ductus arteriosus. Under local anesthesia. Amoxicillin, oral. Adults, 3g 1 hour before procedure. Children, 6 to 12 years, 1.5 g, 5 years, 750 mg. For penicillin allergy or recent multiple doses of penicillin. Clindamycin, oral. Adults, 600 mg. Children, 5 to 10 years, 300 mg, 5 years, 150 mg. Patients with previous endocarditis. Adults. Ampicillin, for 1g. Gentamicin, for 120 mg at induction. Then amoxicillin, oral, 500 mg 6 hours later. Children. Ampicillin, for 6 to 12 years, 500 mg, 5 years, 250 mg. Gentamicin, for 2 mg/kg. Then amoxicillin, oral, 6 to 12 years, 250 mg, 5 years, 125 mg. Under general anesthesia. Amoxicillin and clavulanic acid, for adults, 1.2 g at induction. Then amoxicillin, oral, 500 mg 6 hours later. Children, 5 to 10 years, 1/2 of adult dose, 5 years, 1/4 of adult dose. For patients with a prosthetic valve or previous endocarditis, ampicillin, 4 and gentamicin, 4. For patients allergic to penicillin or who have had more than a single dose of penicillin in the previous month. Clindamycin, 4. Adults, 300 mg over at least 10 minutes at induction or 15 minutes before procedure, then clindamycin, oral or for 150 mg 6 hours later. Children, 6 mg/kg stat, 3 mg/kg 6 hours later. That's all for today's detailed guide on antibiotic prophylaxis. If you found this video helpful, don't forget to like, share, and subscribe for more medical insights. Leave your questions or comments below, and we'll see you in the next video.